Welcome to the Counselor Complete OMS quick overview. In this video, we hope to highlight some specific features, workflows, and concepts within Counselor that we believe can help you and your whole team on a daily basis. We're going to begin by talking very high level about how you access CounselEAR. Then we'll review the dashboard. We'll talk about some of the communication tools built into CounselEAR. And then we'll do a real quick walkthrough through a typical patient encounter, starting with scheduling an appointment, taking them all the way through the point of submitting a clean claim. So we're going to cover a lot of ground in this overview. And like I said, hopefully it helps get a sense of how CounselEAR can fit within your day-to-day workflow. All right, so CounselEAR itself is a cloud-based system. You can access it from any internet-enabled device, so desktop, laptop, tablet, computer, etc. You can be logged in as many times as you like. You can have multiple staff members working within the same patient profile simultaneously. So it's very flexible to access and utilize the system. Now, on that note, with CounselEAR being a cloud-based system, there are two concepts I want to throw out there right at the beginning. One is that everything in CounselEAR is designed to be paperless. There are paper options to things, of course, but the workflow itself is designed to be paperless. The second concept I want to throw out there is this idea of being knowledgeable and proactive. We've built that into various stages within different workflows within CounselEAR. Ultimately, we want you and your team to be able to see the information you need when you need it and be able to be proactive. Right? So I'll come back to that topic a few times throughout this overview. So let's jump to the dashboard here. The dashboard's a very flexible area in the system where each person on staff can design the type of information they're going to see on a routine basis, whether it be about devices and device activity and aging and warranty expiration, or perhaps more invoicing related information, or visit tracking or patient tracking. There's all kinds of different data sets that help individuals see the specific info they need, and not only see it, but take action. So you can find your list, you can send emails directly from here, you can print letters, envelopes, etc. And then when you do send emails or print off letters from CounselEAR, it'll automatically make a note in the patient's profile stating what happened. So this is where we're talking about being knowledgeable and proactive. When a patient calls in and says, hey, I received your email and I have a question, anyone on staff can jump into that patient's profile and know, oh, 3 days ago, we sent you a happy birthday email, or perhaps we sent you a warranty expiration email, or an invoice, or whatever it may be. Okay. On that note, by the way, when we're talking about emailing, CounselEAR does have a very robust email marketing automation system that really dovetails very well with work you can do in the dashboard to automatically send out emails to patients based on 25 different triggers, highly customizable triggers. And that system also backends with Darwell, also known as Blue Wing, for direct mail. So a very robust way of being able to see patient information and communicate with them at the right time with the right messaging. Okay, so let's move on here. So we're talking a little bit about the fact that when you send something to a patient, there's a note put in the patient's profile. That's essentially communication amongst your team. Now, other forms of communication in the CounselEAR, there's real-time chatting, so you can send HIPAA-compliant chatting to anyone on staff anytime, whether it's an individual or a group. You can chat back and forth. There's also tools in CounselEAR that will automatically activate the chatting. For example, when a patient arrives, Arrive can be clicked in the schedule, and that sends a pop-up message to the provider letting him know the patient's ready to be seen, right? So very efficient. Right next door here is the to-do list. The to-do list is the integrated task management system. This is where you can create tasks for yourself, for other people, for multiple people. Those tasks can be specific to a patient or not, totally up to you. And they can be tracked in different areas in the system. For example, right from the dashboard, you can see all of your overdue tasks or due today or future tasks, right? Very simple. You can see this, of course, within the patient profile itself. And so this allows you to create tasks, to track them, complete them, and then view them later on if needed. Maybe there's something you need to refer to that happened a year ago. You can access that anytime. Okay. Now, moving on from communication tools, let's get into that workflow I promised before. So we're going to first just start by jumping here into a patient profile. just so we can see very quickly what the patient profile area looks like. Now, the reason I start here is because in CounselEAR, the patient profile is really home base. This is where you can do about anything for a patient. Some systems require that you do a lot of work on the schedule in order to do other things for this patient. CounselEAR does not. So at any point, if you want to create a chart note for a patient, great, create a chart note. If you want to create an invoice, perhaps for hearing aids, go ahead, create the invoice. You can create an appointment. You do not have to create an appointment, right? And on that note, CounselEAR also has the ability to integrate with any EHR, EMR system. So specifically, if you are in a hospital or ENT-based system, CounselEAR has the ability to integrate with your EHR system and be able to feed data not only from the EHR system into CounselEAR, but also from CounselEAR back into the EHR. Okay, so very robust system there as well. All right, so we're going to come back to this patient profile screen, but let's jump to the schedule. All right. The schedule is very flexible. Of course, you can have multiple locations and jump between locations. You can view multiple locations at one time, so you can overlay your schedule if you have providers that go between locations. You can view multiple staff members or single staff members. View this by day, week, month, or agenda views. Okay, so very easy ways to modify how you see and interact with the schedule. It is drag and drop scheduling built in, so of course you can modify appointments anytime. CounselEAR automatically builds an audit trail so you can see any changes that have occurred over time if anything's been modified. There's also the ability to obviously create blocking schedules as well, or blocking for your schedule as well. What I'm going to do right now is I'm going to go ahead and create one really quick appointment for an existing patient, and then I'll create a quick one for a brand new patient. So I'm going to go ahead and say we are looking for Mr. Johnson. Okay, so we're going to look through. It shows us every Johnson in the list. We can see details around this patient, including alerts that this patient, for example, arrives on transit, or this patient owes us money, right? So you can see the information very, very easily. I'll go ahead and pick the appointment type. These appointment types and referral types are all customizable. So these are just examples we have in this test account. You can also add notes, companion. You can track if a referral source is needed. This can be particularly important when it comes to traditional Medicare, because there are workflows built in place to help guide whether or not, what happens if a referral is needed or not. You reserve a room, you can add to a wait list, so a lot of functionality here. Okay, so let's go ahead and add this appointment. What I want to do now, I'm going to do a second example of this, except for this time I'm going to create an appointment for a brand new patient. So I'm going to go ahead and click on the day and time once again, except for this time I'll click the quick add feature. Okay, so what I'm going to do here is, all right, add in first name, last name, and date of birth. The phone number will automatically format as I'm typing it. And the email address is optional, but really great to get, obviously. So CounselEAR does have a 3-step process for sending out email communications to patients. So when the appointment is scheduled, an appointment notification email goes out automatically. That includes the details of the appointment, plus a link to any questionnaires or intake forms that you want that patient to complete online. And those questionnaires and intake forms are all custom built for your practice and can be appointment type specific. So a tinnitus eval would get different intake and case histories than would a pediatric eval, would an adult eval, etc. Right? So highly customizable. The second step in that communication is the confirmation that goes out via email and or text or call messaging, and the patient can confirm through any one of those 3 methods. The third communication is the appointment reminder that goes out 2 hours before the encounter via email and or text, and just gives a quick reminder to telling the patient to that their appointment's in 2 hours, right? So when you put those 3 messaging efforts together, we want patients to arrive on time. We want them to have as much work done before as possible, and just make that process much more smooth for everyone involved. All right, so for this brand new patient, I'm going to go ahead and click Save. That's going to then take us actually directly to their profile. So now you can actually start to collect more information. You can pick, for example, who their primary physician is. Right, I'm just kind of flying through some of this. You can add more contact information. In this case, what I'm going to do is I'm going to just very quickly put in an address, very poorly. And what you're going to see when I get to this state is it cleans it up. So it automatically looks out to the Postal Service database and says, okay, here's the official address with the zip +4. It also gives you the ability to bring up an interactive map showing specifically how to get from where the patient lives to your office. So you can talk them through the directions and the time needed right from within CounselEAR. And then even better than this, a link to the same interactive map can be included within your confirmation email. So the patient clicks to confirm, let's say 2 days before, and then day of the appointment, they click on the driving directions option, and then it opens up whatever mapping feature they have on that device. So it means that right away, their device can guide them to your clinic. Okay. All right, so a lot more options, of course, within the patient profile, but just to kind of keep this moving, I want to show you also can store insurance policies within CounselEAR. I'm going to go ahead and just enter one very quickly here. CounselEAR does have a fairly large list of payers with their payer IDs already in place. So it's very simple to find the payer you need, get the basic information entered, and then save it. Now, when the patient comes in, we can also store images of the cards front and back. Prior to the patient coming in, there's also the ability to perform an eligibility check. And this gets back to that concept once again of being knowledgeable and proactive. Because one very common kind of big wastes of time within a practice is tracking down claims that fail because of simple errors. This gives you the ability to know before you've provided any products or services, is this information valid, right? Was it read properly to us? Did we type it in properly? Is it still a valid plan? Let's find out, right? So you can retrieve the status. Yes, in fact, this is valid. You can move forward. Or you could message that no, it isn't valid. Well, let's put the brakes on and let's make sure of that right away, okay? All right, so we're going to go ahead and jump back to the main screen. So we have our policy in place. Now we're going to move on to the actual encounter. And this encounter is represented by the visit. The visit is where documentation occurs, whether it's a small chart note or a full visit. So in the visit itself, once again, I'm going to go through this rather rapidly, but the idea is that you can actually take the case history within CounselEAR as you are talking with the patient, right? So you don't have to write anything down. You don't have to remember what they said. You're simply just clicking or tapping, if you're using a tablet computer, on what comes up during that conversation. Now, all of these templates, all these categories, all the templates with them can be customized. They do come preset, but they can be customized from there. And you can see here are the 5 areas that I clicked on in my kind of standard questioning to this patient, right? So it listed it here, meaning I didn't have to write anything down. I didn't have to remember what the patient said. At the same time, CounselEAR started to build the reports, right? So you can see our professional report history is already being written while we are taking the case history from this patient. You can see there are a couple recommendations in place for the professional report and for the patient counseling summary. Now you can modify these as well on the fly. So if you want to click in and type something in, you absolutely can. So that's a great opportunity to get little specific notes in place. You can type in shorthand. The idea is, once again, you're not writing anything down or having to remember what the patient said. Once we finish with the case history, we're going to click Export to Reports, and we'll jump into the testing. Now, CounselEAR is NOAA compatible, meaning you can utilize any testing equipment that you like. So if you have NOAA compatible test equipment, great. You would test through NOAA, and then you could send the test data from NOAA into CounselEAR. Now, the reverse is also true. If you have standalone equipment, you can enter the test data directly into CounselEAR and then pull it back into NOAA, right? So you only ever have to enter your test data one time. Now, with the test data in CounselEAR, you can bring up any previous audiograms and see a shadow audiogram comparison. CounselEAR also leverages the M-class system to perform an initial classification. So this is being called sloping, mild to moderate, sensory neuro, and symmetric. But that classification can be changed based on your preference. So what you see for this audio, you can list that. And this is particularly important because this classification can save you a lot of time in other aspects of the workflow. For example, when you go to write the results section of the report, you don't have to type mild to moderate sloping sensory hearing loss. CounselEAR can do that for you. When you go to determine your codes, right, your IC10 codes are related to this hearing loss, you do not have to be a coding and reimbursement expert. CounselEAR has all the kinds of different combinations and scenarios built in behind the scenes. So this one's pretty simple, H90.3, bilateral sensory hearing loss. But if it was more complex, if you had a mixed loss in the right ear or conductive in the left, that gets challenging. CounselEAR has those code combinations built in. So when we get to the end of the encounter, we'll see how that coding works out. Now you can see a whole series of subtests down below. I won't go through all of these right now, but you can enter them manually, or if you had sent the test data over from NOAA, you would see it populate there. Okay, so let's just add a couple of data points here just to have something in place. There we go. And you can, once again, you can enter as much or as little test data as you like. You also have the ability to add a note directly on the audiogram in this audiogram annotation feature. Okay, so I'm going to jump back to the main screen, and we're going to see now the classification for each year. At this point, we're going to transition right into counseling. So we're going to jump to the patient report. You can customize this very, very quickly, add specific recommendations, and then generate a patient counseling summary. Now, this, of course, would have your logo and your information, but it's designed as a specific counseling summary for this patient. We want to improve what they remember and increase the likelihood they're going to follow through with your recommendations. So it has a familiar sounds audiogram, which you can customize the look and feel of this. It automatically generates a layman's term description of the hearing loss, right? So you don't have to generate this. So even if the patient remembers nothing from your encounter, they can take this home, they can review this at their own pace, they can share it with their spouse, their caregiver, their children, right? And they know not only what you found and what it means, they also know what you're recommending, right? This also can be a very powerful tool when working with physicians, because just to show you what the profession report looks like, now this one is not complete yet, but just to give you a sense, this is the type of report we typically send out to physicians. Well, a lot of physicians struggle to accurately interpret an audiogram. So you can send the patient counseling summary, not only showing the counseling that you're providing, but giving that physician a guide, right? Giving them the ability to understand what it actually means, okay? Now, once you've finished counseling the patient, you of course can print off that patient counseling summary. You also have the ability to email it to them directly from here. So if you'd rather not print it, you don't have to. In general, you can fax and email reports, professional reports, patient counseling summaries, chart notes reports directly from CounselEAR. Very simple, once again, all part of that paperless process. Now, once the patient has stood up and they're walking up to the front desk, there comes a very important juncture here. We need to get information up to the front desk so they can take the next step. So as providers, you would click on Auto Calculate Codes. That will then cause counselor to look at across the entire encounter and say, okay, based on what we know, here are the applicable ICD-10 codes, CPT, MIPS if that applies to you, and then here's our virtual paperless super bill, right? So you can jump in there, you can add more to this if you like, you don't have to. You could say they're adding a box of batteries. In this case, the audio and temps are going on the claim, the batteries are private pay. Okay, now to let the front office know, I'm going to send a chat message. This will be a pop-up message I'm going to send to Linda. She'll then know that the super bill is ready for invoicing. Okay, so just like that, patient's now up the front desk. Linda sees the pop-up. All she has to do is click on the pop-up. It takes her directly into this screen, and then all she has to do is select new invoice. So as you can see, even if you have providers that are new, even if you have front and back office staff that are new and are not, coding experts or documentation experts, this process will guide them. On the other side of the coin, if you have staff members that are experts in coding and reimbursements and in documentation, it can make their workflow much more efficient. So you're making best use of their very valuable time. Okay, so what happened there by launching the invoice is it copied the information over. Now we can see that we can go through, we can collect payments here. CounselEAR does have integrated credit card processing, so you could process a credit card right through here, or the patient can pay remotely, or you can keep a card on file. There's lots of different options. Then we can jump straight to the claim. And what you'll see here is this is really a review process. This is not a, manually creating a 1500, for example, right? So we can see the information autofill. As we go through each step here, we can see that this information is already in place. There's nothing for us to do at this point. We're just reviewing. And then we get to the last step, and you can submit the claim directly to a clearinghouse or not. You can just create the claim and keep it manually submit to any clearinghouse that you want, or submit it directly to ClaimMD or Apex. In this case, I'm going to submit it to ClaimMD. When I click Save, it's going to run a scrub of the claim, looking for any common errors or omissions. That's another way where CounselEAR tries to be knowledgeable and proactive, right? Like find errors, catch them now, because they're very quick to fix now. It can take a long time if they get to the clearinghouse or onto the payer. In this case, it got through to the payer, everything was fine, and CounselEAR sent it out as what's called the 837P file. This is the modern version of the claim that reduces errors and really speeds up the process. One really great thing about sending the claim out in that way is that when it's been adjudicated by the payer, it can then get pulled back in. So if we look here, for example, in claim remittance area, we can see a previously submitted claim that is now ready to be reviewed, right? It has all the codes, the adjustments, the payment. You can see the same information you would see on your ERA or EOB or claim remittance form. And then instead of having to manually enter it, you just click apply, and it then can pull all that information in to the invoice, and you don't have to manually enter it. Okay, so once again, very quickly, that was the high-level workflow of a new patient calling in and taking them all the way through a point of submitting a clean claim. Now, throughout this, CounselEAR course has been compiling data. A lot of that can be viewed in different report generators as well as from the dashboard. And of course, CounselEAR has full systems for tracking devices and for telehealth and all kinds of great stuff. But hopefully this gives you a good sense of some of the core workflows and highlights in CounselEAR. If you have any questions, please give us a call, email us, live chat us. We are always happy to help. So thank you for joining us for the CounselEAR Complete OMS quick overview.